So hopefully at the end of the day, you will end up with a kitten as cute and healthy as this little calico here. And so I just want to thank you for your attention and quickly get to the questions here because I want to make sure we have plenty of time to answer everybody's questions. So I guess Lynn will take it from here.
We'll get right on from the questions. I'm going to push the first question to the viewer. And can you address common shelter disease infections such as Panleukopenia and ringworm? I run a kitten nursery and our environment mimics the shelters. So we see a lot of the same diseases and infections.
Okay, so Panleukopenia, when you're dealing with that, that's going to be one of your viral things. And so what we're going to see in a neonate is going to be kind of the effects of the virus. So you're going to see dehydration. Potentially you can see GI signs sometimes, like a lot of diarrhea that's leading to dehydration. You're going to see them not thriving, maybe not suckling normally, things like that. And if they have ulcerations in their mouths or anything, that's going to cause them to not suckle comfortably. So it's going to be more of a, following things like keeping these guys hydrated, keeping them proper nutritional basis by maybe tube feeding them. And hopefully if you can keep them warm and you can keep them normoglycemic and you can keep them from getting dehydrated, they should be able hopefully to pull through. I mean, you never know obviously, but hopefully you can pull them through to the point where, they're able to kind of mount an immune response and clear the virus. The problem with any virus is there's nothing you can give them to kill the virus. We just have to support the little patient through so that their own body can eventually clear the virus. And just be careful with any kittens that they didn't have failure of passive transfer, because if they didn't have maternal antibodies, that's when they're more at risk of getting the infection in the first place, the viral infection in the first place. So just be careful of orphan kittens and things, and I would maybe err on the side of giving them colostrum, even if, giving them colostrum from a mother or giving them the sub-Q injections of serum if I'm not sure if they got enough colostrum from their mother, and that will help to protect them from that. So Panleuk is like prevention and then just really basic nursing care to get them through it. Ringworm and things, I haven't, me personally, I haven't seen ringworm in a neonate, but if I'm thinking of my experience with a little bit older cats who have ringworm, as long as they're able to kind of like keep up a good nutritional state, eventually they should be able to, be able to clear that infection on their own as well, given time. Or they may eventually need some medication for it, but they need to be really at least 4 to 6 weeks old before we start giving them something for antifungal. So it's going to be more of keeping them healthy and thriving and growing and making sure the nutritional status is good. And same ditto, ringworm they're going to be more at risk of if they don't have appropriate immunity. So just be really aware of cases of failure of passive transfer. So I hope that answers your question.
Great. Let's take the next question. You emphasized not to give antibiotics with diarrhea, but what about developing septicemia from bacterial translocation with diarrhea, hypothermia, and all that other kitten badness?
So just to clarify, it's a good question. Thank you. We want to really be careful of giving oral antibiotics. I guess I should have stressed that more with diarrhea, because it's going to actually make the gut flora be in even worse shape and potentially lead to worse diarrhea. If you think they've gotten sepsis because of diarrhea or because of something else where they got translocation, then you do need to give antibiotics for the sepsis part, and that's when you're going to give IV or intraosseous antibiotics. So if you think you have sepsis, they need antibiotics, and give them IV or IO. If you just see some diarrhea, cat's otherwise doing great, I would deworm them and not touch any antibiotics, and also be careful not to give oral antibiotics for sure. So I hope that makes sense. I hope that answers your question.
Okay, great. Let's take the next question. What is general treatment for constipation in neonate?
Okay, so just same as an adult, you want to make sure they've not gotten dehydrated. So constipation with any animal, if they're dehydrated, that's a problem. So make sure they're properly hydrated. You might need to supplement water, mix a little bit of extra water in with their replacer. Make sure you're diluting the milk replacer correctly. So make sure they're not dehydrated, or make sure they're getting plenty of water. And then you can do enemas, like warm soapy water enemas in these guys. So just put in, a 5 or maybe 8 French red rubber catheter, depending how big these guys are, and give them, 10, 20 mils of warm soapy water, just to get an enema and clear things out, just like an adult. So nothing special. Make sure it's warm water so you don't cool them down too much. So. Okay.
Good. Let's take the next one. Is it harmful to give serum to kittens if you just suspect failure of passive transmission?
Yeah, so I think I kind of answered that already, but just to reiterate, so if you worry they have failure of passive transfer, you should be fine just giving serum, erring on the side of giving them the dose of serum. Just make sure that the cat you're taking the serum from is properly vaccinated, doesn't have any bloodborne infections, anything like that. So, and I should have said that in the talk. If you're drawing blood from a cat to give to another cat, try to make sure that cat is properly screened for disease. They don't have leukemia, they don't have FIV. So if you have a healthy cat available, and a cat that you're worried has failure of passive transmission, I personally would err on the side of giving them the serum. So just have a good donor. So.
Very good. One more question here. In fact, I think we have time for a couple more. How effective is colostrum replacement for newborn kittens that never get their mother's milk?
So if you mean colostrum replacement like giving the serum, extremely useful. And giving the serum subcutaneously replaces pretty much everything that mom would have given them. If you're talking about like any kind of like if I'm using a fake colostrum supplement, I can't speak to those because I've never used one, but the serum is very, very good. And so, if you suspect it, give the serum for the colostrum, to replace the colostrum. So.
Good. Okay, here's the next question. We see a lot of coccidiosis in kittens, especially orphan kittens. Could you address how to treat this condition?
Okay, so coccidiosis is commonly passed from the mother to the kittens. So coccidia is just, something that goes by placental transmission. So, or they got from their mom, or they got from the environment. So it's impossible to prevent it. They're going to have coccidia. So the big thing is you just want to go ahead and deworm them when they're old enough. So usually you need to wait until at least 2 weeks, maybe even a little bit older, before you start deworming these guys. You're just going to go ahead and use Albon to deworm them. But if you're dealing with a, 2-3-week-old kitten, especially one that's maybe very sick and you're just a little worried it's not strong enough to be dewormed yet, you're not going to do a lot for them other than making sure they're still eating or supplementing food if you need to, keeping them warm, keeping them hydrated. It's just supportive care through that initial period. So if they are having diarrhea from the coccidia, that you're making sure that they don't get dehydrated from it so that they can grow big enough to safely be dewormed. But, you can keep their environment as clean as you want, but they probably got the coccidia from mom as they were being born, so there's really not a lot of way to actually prevent it. So.
Okay. Next question is, does 5% dextrose and LRS IV help with preventing hypoglycemia for critical cases?
Okay, so so you can, if you want to, you absolutely can mix your dextrose into your fluids and give it continuously. So you can give it at 2.5% dextrose per liter of LRS or 5%. Either one is fine. I usually don't routinely give dextrose in my bag of fluids unless the animal shows me that it can't maintain its glucose. And the reason I say that is because I'm feeding these guys every 2 to 4 hours. Most of the time, if I give them a bolus of dextrose to get them normal glycemic. After that, if I'm feeding them regularly and they're tolerating the food and that's going well, they usually don't get hypoglycemic after that. And so if I keep dextrose in the bag, they often get hyperglycemic too high. And I don't necessarily want to keep them hyperglycemic continuously. So you can do that. I don't know that you always need to if you're feeding them. And I usually don't need to when I'm feeding them. So. Okay.
We're going to take this as the last question. How would kittens get appropriate colonization of bacteria in their GI system and other immunities if their mother is out of the picture?
Okay, good question. All right, so the bacteria live everywhere. So it's most of the bacteria that they need to get into their GI tract is going to be fecally transmitted. So if they're around pretty much any other cat of any sort, they're going to get it from the other cat. So other kittens in their, if they have a bunch of kittens or there's a bunch of cats or there's other cats in their environment, any of those ways they can get the bacteria. But truthfully, things like E. coli, which is really common in your GI tract, is in the environment also. So, if they're living not in a bubble, they're going to be able to be exposed to the bacteria to get colonized. It's just that being in that, environment with their mother is going to be the most likely place to get it, but they will pick it up otherwise. If you're handling them, we have enough E. coli on our skin and things that potentially is going to, colonize them as well. So those bacteria are very prevalent in the environment. So.
Okay, great.
Okay.
Well, that's the end of our event tonight. We want to thank you, Dr. Tomasky, and all of you for your time.